Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Monday, December 7th, and this is my COVID briefing. First, I just want to apologize. I know it's been a while since I've been able to post a briefing. We've had a pretty bad stomach bug circulating through our household, so this is a good time to remind everyone that as we're moving into the winter months, we are definitely beginning to see other viruses circulating in addition to COVID-19. Okay, so here are the numbers. We've now had 5,214 cumulative positive cases of COVID-19 in Missoula County to date, with 236 new cases since Friday. We've had 45 deaths associated with COVID-19 to date. We're still awaiting hospitalization data at this time, so I don't have that to share with you today. And we now have 751 active COVID-19 cases, which is continuing to trend down a little bit at this time. Remember that all of these numbers, as well as the graphs and figures associated, are on our website at missoulainfo.com. The state of Montana is reporting 68,591 cumulative COVID-19 cases, which is up 720 new cases since yesterday. There are now 17,197 active cases in the state of Montana, with 492 active hospitalizations across the state. There have been 742 deaths related to COVID-19 statewide. Currently, the average new cases per 100,000 people is 63, and we are again currently seeing a little bit of a decline in that number as well. Just a reminder that we're shooting for getting that number down to 25 per 100,000 people. The state of Montana is reporting an average of 67.78 cases per 100,000 people, so we're pretty close to what we're seeing statewide. Today I have a few things to cover. I'm going to talk about the new guidance on quarantine that came out from the CDC last week, vaccine for COVID-19 and what we know and what we don't know at this time, and some changes that have been made to our contact tracing efforts at the health department and what you can do to help make the process go a little bit faster. So first, let's talk about the quarantine guidance. Last week, the CDC issued some new guidance about the necessary length of quarantine. Up until now, if you were exposed to COVID-19, it was necessary for you to quarantine for the full 14 days after the last known exposure and monitor yourself for symptoms. While the 14-day quarantine is still recommended for some people, the CDC has issued some new guidance to help reduce the length of quarantine time for most people. Now, quarantine can end after 10 days without testing as long as you remain asymptomatic. You should still monitor yourself for symptoms for the full 14 days and continue to report to our monitoring system for the full 14 days, but you can resume normal activity without the need for continued isolation after day 10, as long as you continue to remain asymptomatic. We're immediately implementing this with our team. If you've passed the 10-day quarantine period, but you've not yet been released at 14 days, our team is working as quickly as possible to contact you and get you released from quarantine. This is going to take a couple of days, as that means that they have to contact hundreds of people, so please just be patient with us. If you were recently exposed, you will automatically be moved into that 10-day quarantine period. The other option for an earlier release from quarantine is that quarantine can end after 7 days if you receive a negative test after day 5 and remain asymptomatic. And again, you still want to monitor yourself for symptoms for the full 14 days. Due to the continued high volume of people experiencing symptoms of COVID-19 here in Missoula County, we do not have the capacity currently to offer asymptomatic testing in order to facilitate this. That said, we will continue to reassess, and if we see a decline in those having symptoms and we're able to open up asymptomatic close contact testing appointments, we will certainly let you know. Next, I want to talk about the COVID vaccine that should be starting to trickle into our county over the next few weeks. So here's what we know. Montana will receive 9,750 doses of the Pfizer COVID-19 vaccine in the next couple of weeks. They expect it to be getting into Montana by about December 15th. The vaccine requires 2 doses, 21 days apart, to be effective. The Advisory Committee on Immunization Practices, or the ACIP, recommends that the first groups to receive the vaccine be healthcare personnel working on the front lines with patients and residents and residents and staff of long-term care facilities. While it's encouraging that a vaccine is going to start trickling in, it could still be several months before it becomes available to the general public. So we're working really closely with our healthcare partners and the state of Montana DPHHS to ensure that we can get the vaccine distributed to those eligible in as timely of a fashion as possible. And we'll continue to keep you posted as we get more information. The last thing I want to talk about are some changes to our contact tracing system. We've now fully transitioned to a system called Sarah Alert for contact tracing. This is an electronic system used by public health across the nation to help speed up contact tracing and monitoring of contacts for symptoms of COVID-19. While we had a delay in reaching people while we were transitioning, this process is now moving much faster. If you are identified as a positive case or a contact to a case, you will receive one telephone call from our team, and then you'll automatically be enrolled in Sarah Alert. So if you receive a text message or a voicemail from our team, please return their call, as this can greatly reduce the amount of time it takes for us to get through the contact tracing process. While I know that a lot of the time it becomes much more real when you're the one that's being directly affected by COVID-19, it would really help our team if you could become familiar with the basics of COVID and quarantine and isolation. This information can be found in the FAQ section on our website at missoulainfo.com. If you have this basic knowledge before receiving a call, our team can get through the interview with you much more quickly, allowing them to move on to the next person that they need to call who's in the same situation as you are. So that's it for my briefing for today. As always, you can subscribe on YouTube under my name, Cindy Farr. That's CindyFarr. Click that notification bell so that you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department's Facebook page, and check out our website at missoulainfo.com for all kinds of great information, as well as all of the data that I present here to you. You can also call 258-INFO if you would like to schedule a test for COVID-19, or if you have general questions that you would like to ask about COVID-19. So until next time, everybody stay healthy.